Dr. Idusuyi is somebody that cares about other people, and he's the type of guy that when he has the means to do something to make a difference, he does it, and he doesn't expect recognition for it. When he first started with us, my boss had told me that he had a hospital in West Africa. It really amazed me that he puts all the time and effort in that he does. It's hard to find time to do stuff, and he goes there twice a year on missions, and the hospital is open year-round. So what was really interesting to me was that he actually pays the salaries of all the staff year-round that staff St. Gabriel's. Some of the pictures I've seen from him being over there are really cool, because there's pictures of the waiting room that are just packed with people, and you can tell they all just really admire him for being there, and that they're really grateful that he's able to come there and provide the service for them. And to hear somebody that's actually paying for the staff to do it was something that I'd never heard of before, and something that really stood out to me as somebody that was deserving of a hero's nomination.
When I finished orthopedic school, I immediately wanted to give back to the community where I came from, Nigeria. So I came up with a bunch of doctors. We had a bunch of medical equipment, tools of the trade to do orthopedic surgery. So when I got there, and I found out that what they really need was basic health care. They just need food, water, access to care. When we get the first visit there, we had one doctor and one nurse, but when I came back for the second visit, there was a lot of more patients out in the door. So I just decided to change from a clinic into a bigger medical center. The little kid that needs basic hygiene, the pregnant ladies that need basic antenatal or prenatal care, and a bunch of education. That's what they really needed. But majority of the death is from malaria and cholera, dysentery, which is basic hygiene. And so all I'm really doing, I'm not giving the expensive medication, is just telling the little kid on what to do to wash their hands, how to take care of themselves. We treat at least 25 to 30 patients a day, from all walks of people that live in that area, people that travel miles and miles from the villages. And when I'm come for the whole week, we see close to 200 to 300 patients a day. Right now, we focus on primary care. I'm a surgeon, and I do a little bit of, we have one operating room suite. I do some small little operation there, but I want to make it more of a standardized hospital where I can do orthopedic surgery or do more state-of-the-art surgeries there. When I come, it's like I'm treated almost like a hero. Everybody's gathered around me. I just feel like I don't deserve all of this, and they all gather around me. And they feel like I'm the person bringing hope, bringing life, changing medicines, or giving them a life in life. And they gather around me, trying to touch me and look at my equipment and look at all the drugs I've brought. I just feel humbled. I don't really feel like I'm really doing anything significant. I feel like I gain more from them than they actually get from me. When I look at those little kids, I have 3 children of my own, and when I look at those kids and I see the happiness on their faces, after they've been able to, get cured from the malaria, that just gives me the whole impetus to come back. And it always leads me to a famous poem I've read several years ago by an Indian poet that says, I slept and dreamt that life was joy. I awoke and I saw that life was service. Behold, I acted. Service was joy. And that's pretty much sums up my entire experience at St. Gabriel's Hospital.